If you've been referred for a gastroscopy, you've been referred for an examination of the upper gastrointestinal tract, which includes the esophagus, the gullet, stomach, and the duodenum. We do this examination with a very thin, flexible telescope called a gastroscope, all while you're asleep. Now, the preparation for the gastroscopy does require you to be fasting. Fasting means no food and no drink for 5 hours. And by no drink, we mean no water, no tea, no coffee, no alcohol. You need to come with nice, comfortable clothing and an escort. You can't drive home. You'll be sedated for the procedure, which means you won't feel the procedure at all, but we can't let you operate machinery. And it's very important on the day of the procedure that you don't sign any legal documents or do anything that's particularly important in terms of decision making. It's very important that you know your medications. We want you to have a list of your medications. There are some drugs that are very important for us to know in advance of the procedure. We may have to stop them. For example, diabetic medications, be they oral hypoglycemic agents or insulin. If you're on an anticoagulant, blood thinners like aspirin, warfarin, and the newer acting anticoagulants, we need to know about those before the procedure. They may have to be stopped in advance. You will be thoroughly evaluated by a pre-admission nurse and also by an anaesthetist before the procedure. During the procedure, you'll be brought into a endoscopy theatre. You'll have a mouth guard placed in your mouth to protect your teeth from our instrument and our instrument from your teeth. And the anaesthetist will place a needle in the vein through which you'll administer a drug that will have you fall into a beautiful, nice sleep. And during that sleep, you won't feel any aspect of the procedure. We're examining the esophagus to see if there's any inflammation. You may have so-called reflux dyspepsia. We'll examine to see if you have a hiatal hernia, whether there's any narrowing. We'll be examining the stomach to see if it's inflamed, whether there's a bacterial infection there called Helicobacter pylori, whether there's an ulcer. We'll be examining the duodenum also to see if there's inflammation or ulcers, or whether you may have a condition called celiac disease, which is a wheat intolerance. After the procedure, which takes about 15 minutes, you'll be wheeled into the first stage recovery where you'll be pampered by some beautiful nursing staff. And then after that, you'll be woken up and given some beautiful refreshments.